Hi everyone, I'm Katie Danini with Otsuka America Pharmaceutical Inc. And I'm here today for a discussion with Sarah, a patient living with ADPKD, Dr. Meyeon Park, a leading nephrologist and director of the UCSF Polycystic Kidney Disease Center of Excellence, and Chris Rusconi, the Chief Research Officer at the PKD Foundation, for a discussion on polycystic kidney disease, or PKD. Hi, everyone. Thanks for being here today.
Hi, thank you.
Hi. Hi. So let's go ahead and dive in. Dr. Park, can we start with you? Can you help us understand what is PKD?
Sure. Thanks for the opportunity to be here today. PKD is what we will use as shorthand for the condition known as polycystic kidney disease. And generally, polycystic kidney disease is referring to one of two conditions, either autosomal dominant or autosomal recessive polycystic kidney disease. Autosomal dominant polycystic kidney disease, or ADPKD, is the most common form and presents in adults, which is the primary population that I treat. So when I say PKD, I'm usually thinking of ADPKD. What happens in ADPKD is that tiny cysts will form on the kidneys due to a genetic mutation. And over time, these cysts grow larger and larger and overtake the normal kidney tissue, such that kidney function will decline. These cysts can also cause many other complications, including pain, infection, rupture that can cause blood to come out into the urine. And in fact, these cysts can be seen in some other organs as well, such as the liver, that can cause some manifestations in the rest of the person's body that can also be associated with some complications.
So how is PKD diagnosed?
Sure. So it depends a little bit on whether one has a family history of the condition or not. As I mentioned, autosomal dominant polycystic kidney disease is a genetic condition, and autosomal dominant means it's passed along generation to generation. In individuals with a family history of the condition, sometimes people will actually seek a diagnosis because they know that it runs in their family. And in those situations, they may go to their doctor and say that they would like to be evaluated and have a kidney imaging study, such as an ultrasound, CAT scan, or MRI, to see whether there are cysts on the kidneys. And that is the way that a diagnosis can be made. In up to 20% of cases, individuals may not have a family history and may actually get diagnosed for another reason. Those individuals would still be at risk of passing along the condition to their children. And this happens because this genetic condition is actually the result of a mutation that happens in a gene for polycystic kidney disease that is actually a very long gene, meaning that there are many ways in which it can get mutated, many different places that it can experience changes, even in families that don't have a family history. Sometimes people will get diagnosed because of high blood pressure or some other complication like kidney stones that occur incidentally. Of course, these are common conditions in the US to have high blood pressure or kidney stones or some other problem, but in evaluating those circumstances, especially in a younger adult, it may turn up this diagnosis.
So PKD is a progressive disease. What does that mean?
Sure. So progressive basically means that the disease will evolve over many years and cause different signs and symptoms and different complications over time. As these cysts grow, they grow by accumulating fluid, loosely speaking, and that fluid will accumulate, cysts will grow bigger and bigger and bigger. and these cysts will overtake the normal kidney tissue. And what that does is that it will cause the normal kidney tissue to react to being stressed and will no longer allow the kidney to function properly. Normally, the kidney function is quite intricate and miraculous, and the kidney will take care of balancing every electrolyte in the body perfectly, will maintain our water balance, will regulate blood pressure, will secrete certain hormones that are important for body function. And when the kidney is compromised in this way, it can't perform those functions as well as it should. So with time, the kidney function progressively declines.
One of the things that's always been most shocking to me when understanding PKD has been in understanding what a normal sized kidney should look like and how big a polycystic kidney can actually get to be. And I think one of the best analogies that I've seen is that a kidney can really be as big as a football, which really shows on the outward times, sometimes in patients. Am I correct?
Definitely. And I've seen some even bigger than footballs. Not that I'm that familiar with the size of a football, but I think that in fact, this is one of the major complications that can really impair individuals' quality of life, and not just quality of life, but health, because as the kidneys grow larger and larger, you can imagine how this will cause pain and can compress other organs, can move other organs such that they don't function as they should. And sometimes people will experience this to the point where they can't eat full meals because their stomach is compressed. They feel uncomfortable and bloated and distended and in pain when the kidney cysts grow.
Thank you for that. What should someone do if they've recently been diagnosed? Any tips?
So I think it's really important for everyone to be plugged into care with a physician whom they trust. There are kidney specialists across the country who are familiar with this condition and who treat many patients who have this condition and many families who have this condition. I think that establishing a relationship with a provider at the earliest possible time will set them up for success so that they can be managed from early stages all the way along the course of this progressive illness.
Sort of final thought in that the reality is we're living in this pandemic, right? And so what does that mean around managing your condition? What should patients expect? And I'm sure for me, I would be really fearful, right? And even going to my doctor's office. So can you help us understand what does managing your condition look like during these times?
I think that's a really important question. And in fact, these times are throwing curveballs at everyone, to say the least.
Yeah.
But it's still extremely important for patients to be in care. And while that may take a little bit of a different look right now because of the pandemic and the risk that everyone faces, it's still very crucial because management is an everyday problem that we need to face and take control of. So blood pressure, water intake, treatments that have been recommended to patients for the conditions that sometimes are associated with declining kidney function. Monitoring all of these are really important, and that may require frequent blood and urine tests, as well as blood pressure checks, as well as physical exams or examinations and assessments by a physician. So now that the pandemic has been continuing, there have been I think, adaptations that the health system has made in order to acknowledge that this is our reality for right now, because we can't just put everything on hold permanently, especially when it comes to our health. So I think that actually most centers, physicians' offices, phlebotomy lab draw centers have all put into place steps and safety measures to make sure that patients can still receive the care that they need. So facing the challenges, speaking with a physician, coming up with a plan that's individual for what that person will need in the immediate term, and ways to overcome the challenges together, I think are really crucial right now.
Dr. Park, thank you. I hope that really helps some of our viewers and some of the questions that they may have. But we know that for patients, they really want to hear from other patients. So Sarah, could we ask you a couple questions about your diagnosis journey? And, I know you're dealing with this too through a pandemic. So could we start in asking you, what did your diagnosis journey look like?
Yeah, so my diagnosis journey was very interesting. In my family, having PKD seems almost more normal than not. My great-grandmother, my grandmother, my mom, my uncle, kind of you name it, and they had it, and that includes me. So when I was 3 years old, my parents took me to get an unofficial diagnosis. We had a sonogram done. They begged the doctors not to add it into my chart because they feared I would have problems getting health and life insurance in the future. But when they looked at that sonogram, they knew what that meant, and they must have told me at some point, because I feel like I grew up always knowing that I had it. Officially, when I was 19, I was having dizzy spells, high blood pressure, increased heart rate. And at that time, they said, you need to connect with a nephrologist. And I did. We did more sonograms of my kidneys. I kid you not, when I was in his office at 19 years old, I'm sitting there looking at my films on the wall, and my kidneys look like Swiss cheese. That's how many cysts there were. And I was stunned. Mm-hmm. And then I was super angry. I'd always known, but this was the official confirmation. And I just didn't understand why my parents would have chosen to have children, knowing that they could have had one who had this diagnosis, since it's a genetic condition. It was the first time I started to think about what the end of this disease might really look like for me. And for a 19-year-old, it's hard to face that you may eventually lose your kidney functioning. So I got diagnosed. I basically did everything I wasn't supposed to. I wasn't compliant. I didn't take my medications. I didn't follow any of the advice I was given. I just kind of pushed everything to the back of my mind and ignored that I had this diagnosis. And one thing that really started to come up in my life was emotional eating. It became my way to cope with just knowing of this condition. And unfortunately, it got to the point where I was eating for all of my emotions. It didn't matter. Happy, sad, upset, joyful. Food was the one thing that connected everything together. So I ended up weighing 395 pounds. And as you can tell, this was extremely detrimental when you have PKD. Yeah. Just the complications of being morbidly obese and having a genetic disease, knowing that I got put on more and more medications. And as I continued, if I were to need a transplant or treatment, being that overweight could seriously hinder any of those options for me. So that's kind of a little bit about my diagnosis journey.
Yeah, thanks for that. And really, that image of looking at your films and looking like Swiss cheese, how powerful. And I can't imagine, me at 19 seeing that, what a journey that must have been, an emotional journey that was for you. Can you help us understand, when did you start actively managing your ADPKD?
So I was at my annual OBGYN appointment, actually, not my annual nephrologist appointment. And I had a wonderful provider, and she sat me down. At that point, I was 395 pounds. I was sweating from trying to take the stairs. I was shoved into this hospital gown that didn't fit me or my body. And I was ashamed, embarrassed, mortified. And she sat me down and she looked at me with more compassion than I thought possible and just asked me, Sarah, what's going on? You've been my patient for a long time. I care about you. I'm invested in you. I know you have ADPKD. You're on more and more medication. I'm worried about you. What is happening with you? And I just lost it. Like, I broke down in tears in her office. And it was really the first time for me that I felt like I was confronting these choices I'd been making with emotional eating and ignoring my disease were just all kind of flooding in and staring me in the face in her office. And she told me about her own struggle with weight and her journey to be healthy. And I think the most important thing was she looked me in the eyes and she said, you can change. This isn't impossible. You can change. And just having that knowledge, it just made it seem possible. So we talked about a plan. I started making really small changes. Like, I started really slowly. I started with 1 meal a day, maybe making that more healthy. And really everything snowballed, making healthy choices for breakfast led to making healthy choices for lunch and dinner. When I got 50 pounds off, I started walking. The first time I went to a gym, I couldn't walk a mile. I was in pain. I was sweating all over. But a couple months later, I walked a 5K. I mean, I wasn't the fastest. I certainly was not in the first group to finish. I was in the second to last, but I did it. And it was like everything that I did just fueled me to continue to be healthy. And I think not only was it being healthy in a weight loss and that way, but knowing every pound I lost, I was being healthier with my PKD condition as well. I was taken off of medications. I was drinking more water. I was eating the things I was supposed to eat. And that was naturally helping my journey with PKD.
Sarah, that's awesome. Congratulations on that. What a story of inspiration. And I'm sure you had a whole bunch of cheerleaders cheering you along. So how has it been during the pandemic? I know Dr. Park talked a little bit about, what this looks like in managing your condition during the pandemic, but what has your experience been?
Well, it's certainly been interesting. One thing I will say when I chose to get healthy is I made a choice not to let my condition define me anymore. I decided that it wasn't going to hold me back from anything that I wanted to do. And that has kind of continued through the pandemic. I had my son on January 8th of this past year, and he has been wonderful bringing him into our life.
I'm so happy.
So thank you. We are so happy too. But near the middle of my maternity leave was when the pandemic was really starting to ramp up. And it was scary. I have an underlying condition. I have a 2-month-old baby. We don't know if he has ADPKD or not yet. We haven't gotten him diagnosed. So he may have an underlying condition, not to mention, he's an infant. Like, anything right now could be detrimental. So I was really scared. But I had a great care team, and they encouraged me, like, keep your appointments. We have just like Dr. Park said, my care team had a plan in place. I felt safe when I went in to see my physicians. It was really important for me to keep going to those appointments and managing my postpartum, my ADPKD, my son's appointments, getting all of those things in line. And then I just had a great support system outside as well. Having a mom who has the same condition. I said earlier, when I was diagnosed, I didn't understand why she wanted to have children. When I got married, I understood why she wanted to have children. It made sense. And having a child, I can only imagine how she's felt her whole life, knowing that I have the condition, and how I will feel knowing if we find out that my son has the condition as well. So having her there and talking to her about different strategies, making sure my husband and I really went hard on social distancing and mask wearing and making sure we were safe, because it's not just about keeping us safe anymore and my kidneys safe, but it's about keeping my son safe too. So it's been difficult. I am back at work. I'm actually in the office a couple days every week. I feel like we have really good safety protocols in place. We have social distancing. We have lots of hand sanitizers, lots of masks, and we're doing the best we can to continue to live in these tumultuous times. But having a great healthcare team and having a great support system has really helped me manage during these times.
Well, first I want to say congratulations.
Thank you.
I'm about a year past you, and so I know what a crazy time that is. So thank you for all that, and how scary, especially with everything that's going on. But I think you made a really good point about a care team, right? And how important that care team is. And, you know, it doesn't seem like, it seems like that kind of built over time for you, and has really helped to surround you with that support that you needed through this. Is there any other advice that you would give to someone who's facing ADPKD right now?
I mean, I think the thing that I would say is, this isn't who you are. You're so much more than your diagnosis. Do not let it control you. You're a person. You may be a mother, a brother, a son, an aunt, an uncle. You are so much more than just the letters PKD. And I think that's the number one thing I can say. And number two would be, find that team you can trust. Find the nephrologist that knows about your condition and is willing to, let's talk about different things we can do. You know, find the primary care physician who's like, I have a great primary care who, when she has any questions about like a medication or something, she goes, oh, I need to talk to your nephrologist. Hold on. She's wonderful. So make sure you find that primary care that also understands you have this condition and that may impact in other areas. And then find your other support system. You know, whether it's you can go to pkdinfo.com, the PKD community, whether it's your family, your friends, know that there are other people that are on this journey with you, and we're here for you. So reach out.
Thank you, Sarah. You touched on something really important, and that's around resources. And we've got Chris here from the PKD Foundation. The foundation does incredible work in pulling patients together and providing resources and support. And Chris, you know, we're celebrating, we're into September. We are celebrating PKD Awareness Month. So I'd love for you to share a little bit about PKD Awareness Month, a little bit of the foundation, and help us understand those two things and what we're building awareness around.
Wonderful. Okay, great. First of all, thank you so much for having me. And Sarah, thank you for sharing that. So yeah, it's PKD Awareness Month. Yeah, so it's funny. So at the foundation, we're always trying to really shine light and create awareness about PKD, engage patients, engage their families and physicians. This just happens to be the month when we kind of turn the level up and shine it more brightly, right? Where we really want to help, you know, everyone nationally and locally get the message out and about PKD so that people can be diagnosed, be educated about their disease, really empower them to be able to, as Sarah said, you know, be more than their condition and really take charge of their health and well-being. So we have a number of events going on. I think lots of people have, you know, a number of events going on to try to bring awareness, you know, within the foundation. Certainly we'll be kicking off the walk season starting on Friday. It's also a big anniversary for us with our registry. We'll turn 1 on Friday. Not quite the same as having a baby, but it's still important to us.
For that.
It's our little child.
Yeah.
And yeah, so that's the awareness month. We'll also be promoting, at the national level, resolutions through the House and the Senate to really broadly broadcast that that it's an important month for everyone to learn about the disease. Now, when you think about the foundation, we're the largest organization in the U.S. that's solely dedicated to PKD, and our mission is really to bring hope to patients, and that's both as Dr. Park mentioned, patients with autosomal dominant as well as autosomal recessive PKD. We do that through a variety of programs. Research is near and dear to my heart, so I'll say research, and then I might circle back around if it's okay and say a few more things about research. But we both promote and engage in research, and I think it's important now with the registry that we talk about that we're actively engaging in research. Obviously, education is super critical, so we have large programs related to education and patient support, and then a number of ways for folks to get involved in helping create awareness and supporting the foundation, our mission, including advocacy and local events. And a lot of our advocacy at this stage is directed towards federal work, largely around, again, research and research dollars, and helping grow the resources available for the research community to improve our understanding of disease. So that's a sort of a thumbnail of the foundation, Katie, and I'd be happy to dive into anything that you'd be interested in.
Well, I want to give you the opportunity. We're about to, unfortunately, we can't walk together, right? But we'll be walking in our own communities. Walk's coming up, correct?
Correct. Yeah, so Walk's coming up, and it's been the community engagement team and the advancement team within the foundation have done a wonderful job pivoting to an entirely virtual walk season with the pandemic. And so we'll announce the kickoff on the walk season on Friday, and then there'll be a virtual walk season between October 9th and October 18th, so a 10-day event. It's I think, a very well organized, very lovely event, lots of social media contacts and a lot of ways for people to engage with each other virtually and safely while, raising awareness for the disease, raising funds for the foundation. So I encourage everybody to go to pkdcure.org. There's my infomercial, and you can obviously learn about the walk. You can learn about a lot of the other, I think, important resources we have for patients and their families as well, like finding a clinic, finding a clinical trial, basic education materials. Obviously, you can connect to our registry through there as well.
Chris, help us understand. I know your registry is your baby. I think you guys have some lofty goals around that. Help us understand, how does that support and advance the work around PKD?
Oh, wonderful. Yeah, so yes, it is. So we turned one on Friday, and our registry is fairly unique. It's the only direct-to-patient national registry, and that's important. I'll tell you why we think that's important. So you can collect data in registries in a variety of ways. You can collect it from medical records. You can collect it from insurance records. We're collecting the information in our registry directly through patients, and for a condition like PKD, where patients are seen sort of everywhere and are very distributed in their care. We think that's a really good model to pursue. We think it's also important because, the patient is, Sarah shared some really moving, experiences of her experience with the disease. And when you think about patient-reported registry, I think at least we feel we get a much richer view of the disease than you might get just from medical records, how the patients experience pain, fatigue, quality of life. And why that's important is so our registry is longitudinal. And so that means is we're collecting data over time. And as we collect that data over time, it really can help us see, how one's caring for oneself, how is, what interventions a patient might be receiving, how is that impacting the course of the disease. That should help us over time learn how patients can better manage disease. It's also important for the purposes of research. So one of the second goal of the registry is to help to connect patients with clinical trials. And so we think that's important for advancing research. It's important for the research community, important for the patient community. And so when patients consent to participate in the registry, they consent to also be informed of clinical trials that they might be, that they might meet the criteria for. And so with having the patient-reported information, the registry can do a much better job of potentially identifying folks who may qualify for a clinical study than any other tool the registry have. And so we've just actually this week started our first use of the registry for recruitment, which is really exciting. And so that's think important, obviously, for patients. And then the other bit is, anybody, as patient enrolls, there's a patient individualized dashboard. So it gives a way a patient to really see, how their disease experience relates to other patients' disease experience. So we're hoping that by connecting patients to research and educating them, that we can, in addition to the other goals of the registry, really help promote their understanding.
That's great, Chris. So we've got, we've got a way for patients to be able to connect with one another, whether it be through Walk or another forum that the foundation has. There's information and resources, right? And then there's the research side. And so, if someone's newly diagnosed, where's the best place for them to go? I'll let you plug some more information in for the foundation.
Yeah, so certainly there's a tremendous amount of educational materials on the foundation's website, which I said is pkdcure.org. There's handbooks that provide, I think, really great detailed information about the disease for both patients with AD and AR as well as their families. I think some of the recent updates to the website in terms of finding a clinic are really useful. So again, patients are all over the place, and so Elise Hoover at the foundation is working hard in building a database of clinics around the nation who have certain specialties, so patients can look and see, okay, here's the types of care that are offered at these clinics, and find clinics near them. Likewise, if a patient is interested in participating in a clinical trial, that information is also available to them. And so that, I think, is a good starting point. There's also peer mentor programs that can help link patients to patients and help get that peer mentoring, as well as that I think you and Sarah both indicated is so important, especially for patients earlier in disease. And so that's really a lot of the educational materials. And then just one last bit on research. We have the registry. We support basic research. That's been a sort of a foundational aspect for the foundation since its inception. We have the registry, which is us engaging in research directly, contacting and interacting with the patient. And then in between, we're a collaborator in the Polycystic Kidney Disease Outcomes Consortium, and that's really a community of healthcare regulators, so the FDA, the European Medical Association, industry experts, academic experts, patient organizations, where we really look to find ways to help drive the development of therapeutics and treatments for PKD by helping, develop tools that facilitate clinical development. So we're really trying on research to, on one end, be with the basic researchers and help foment understanding. On the far end, be really directly engaged in research with the registry, and then in the middle, really help to continue to drive a pipeline of treatments and understanding of how we can bring benefits, how the community can bring benefits to patients.
Awesome. Chris, thank you for sharing all of that and the great work that the foundation is doing.
Thanks, Katie.
Sure. Is there anything, Dr. Park, Sarah, anything in addition that you want to share today that you may have wanted to share during your talk and didn't get a chance to before we close up today's discussion?
I'd like to say congratulations to Sarah on the arrival of your son, and also to echo everything that Sarah said about getting a team who's behind you and with whom you can work as a team, I think is a really crucial message. I totally echo that, because I feel very privileged to be part of that team for many, many, many patients and their families. And I think that knowledge is power. So getting the information and learning about the condition and the resources, as Chris mentioned, is extremely important and empowering. And even though it may be initially intimidating and scary and potentially cause worry, really getting the information and having a team who can help you process that information and use it to your benefit is the main goal of everything that we're trying to do with PKD awareness.
Thank you, Dr. Park. Sarah, is there anything you want to share before we end today?
I think I just want patients to know there's hope. I mean, my grandmother was on dialysis for 17 years. My mother had a kidney transplant. There's hope. And just knowing that all this research and education and resources are available to me, just like Dr. Park said, knowledge is power. And people are looking and doing and researching, and they want to make this better for us and everyone like us. So just don't give up hope.
Thank you. Thank you, Sarah. Thank you, Dr. Park. Thank you, Chris, for joining us today. I think the discussion was fantastic, and I think we're leaving those who are viewing with us some really good messages of hope and where they can find more information. So we're going to do our best to respond to any questions that you have, but because we're in a regulated industry, we may not be able to answer them all. But we really encourage you to talk to your own healthcare professional on any questions that you have. And with that, I want to say happy PKD Awareness Month and stay well.